and welcome to BEaTS Research Radio, a podcast and YouTube channel dedicated to communicating research and science to the community. At the start of the pandemic, children and adolescents were regarded as some of the least at risk for medical complications of COVID-19. However, many children are struggling with invisible consequences of the pandemic, including a growing crisis of poor mental health. Joining us today to discuss on this topic is Dr. Nicole Racine, a clinical psychologist and postdoctoral research fellow at the University of Calgary and the Alberta Children's Hospital Research Institute. Thanks for joining us today, Dr. Racine.
Thanks for having me, Nicole.
Now, we're so happy to have you on our channel, and I want to start by asking about one of your recent studies. Over the summer, you published a meta-analysis of child and adolescents' mental health during COVID-19, pulling together data from over 29 studies globally. Can you share with us some of the major findings from the study?
Yeah, sure. So as you mentioned, this was a meta-analysis, so that means a study of studies, where we were looking at the prevalence rates of clinically significant depression and anxiety in children and youth within the first year of the pandemic. And what we found was actually about a doubling of prevalence rates for depression and anxiety symptoms. So about 1 in 4 youth were reporting concerning levels of depression and 1 in 5 for anxiety. And we found that these prevalence rates were higher in studies where there was a higher proportion of girls, of females, and then also in studies where youth were older, so more so in the teen years than in younger years.
Oh, certainly. So that definitely a big impact on mental health of youth. So can you explain more about, with many schools reopening in Canada, how this could possibly impact the mental health of children after a year of this virtual learning and social distancing?
Yeah, so this is a really interesting question, and I think one that still needs to be studied and borne out in the research. But what we do know and anticipate is that in studies where restrictions have been relaxed and they were looking at pre and post measurements of mental distress, they did see improvements. So we would anticipate perhaps that some of the more acute and concerning levels of distress that we were seeing, that actually keeping kids in school is really important. And we think this is an important contributor to kids' mental health improving.
So for mental health improving, could it be that socialization aspect of the in-person classes, or also due to like other factors, maybe like the mental health resources offered at schools?
Yeah, so I mean, all of those things, I think, as we know, schools are much more than places where you just go to learn. So they're a place where you interact socially with peers. There are other positive interactions with adults. They're also a place where kids get mental health support. Some kids, it's breakfast and lunch that they're getting at school. For kids where maybe things aren't going so well at home, it's an opportunity to be away from that and to have a stimulating environment. So we know that schools are protective in so many ways. And in a recent policy report, actually, that was published by an author at the University of Ottawa, Dr. Tracy Vaillancourt, she talks about schools being needing to be the last to close and the first to open. That's really how important schools are.
Definitely. And I definitely agree what you said about schools being the last to close and the first to open. And do you think that maybe this year after distance learning and virtual schooling that children, their mental health like definitely suffered quite a bit?
Yeah, I mean, I think different children had different experiences. I think on the whole, most children were extremely happy to return to school in person. I think there have been a lot of benefits of that. I think maybe some kids never thought that they would say, like, I'm so excited to be going to school, but they are. For some kids who are more socially anxious and have a lot of anxiety, we actually saw a bit of a decrease in anxiety for some of them in the online schooling because they didn't have the same number of stressors. And kids also had quite reduced, their lives became much more simple. So, as much as there's a lot of things to benefit from with regards to extracurricular activities in school, we also need to think about the fact that kids also perhaps were experiencing less stress by being involved in less things. But I think what we do know is, on the whole, we would expect that kids do better, and it's important for them to go to school.
Definitely, that socialization aspect of in-person classes is really, really important. But there's also that uncertainty that COVID-19 is really long-lasting, and it's an ever-changing situation, right? With the school boards in Ontario and in Alberta. Like on the news recently, I heard how Alberta are closing their schools due to a rise of COVID outbreak cases within classes. So, what do you think are the potential long-term impacts on development if this mental health crisis in children is not immediately addressed?
Yeah, I mean, I think what we know and what we anticipate is not only, is there a slide, what they call the COVID slide, which is the idea of, kids having gaps in their learning. But we also know that during the pandemic, that perhaps kids also weren't able to access the resources that they needed, and now, in many instances, are seeing increases in referrals. That many children's hospitals across the country have reported increases in the number of kids who are coming in urgent mental health situations. So this is really, really concerning, and I think we know that there needs to be an allocation of resources for children's mental health. Our children's mental health system was one that was overburdened and underfunded before the pandemic happened. So in Ontario, for example, there's um, a slogan from Children's Mental Health Ontario, which is hashtag Kids Can't Wait. And kids couldn't wait before the pandemic. And now the pandemic has happened. We've seen increases in prevalence rates of mental health difficulties and a decrease in access. And so, still, kids still cannot wait. It's important for us to address this.
I liked how you brought up how COVID-19 isn't the sole reason that caused mental health burdens in children, but really like a catalyst which brought it to the surface, right? This issue.
Oh, for sure. And I think, in many instances, we can hypothesize there might be different groups of kids, right? There might be kids who perhaps experienced a short-term increase in their mental health difficulties, but that will resolve. There's the kids who had mental health difficulties before the pandemic, and those may have been exacerbated by, increases in stress, loss of social support, and loss of the mental health supports that they had. And then another group who mental health difficulties may actually have been catalyzed by the pandemic and will be maintained. So some of the research that our group is doing actually with the longitudinal cohort in Alberta and following kids over time during the pandemic will actually help us to know to test the hypotheses about those different groups of kids and whether or not that was or wasn't the case.
Definitely. We'll definitely keep our eyes peeled out for this longitudinal study, which your group is doing. So, as a practicing clinical psychologist yourself, you get to interact directly with children in the hospital. So, what are some protective factors that you would like to see implemented to help improve mental health for children?
Yeah, so I think a really important protective factor that we've seen throughout the pandemic are, within families, caregivers, parents within the home, being supportive and having positive relationships with their children and youth. So that's, having those supportive caregivers is immensely protective. Also, being able to still be connected and having a sense of belonging with peers. So, whether that's through just social connection online or through some kind of extracurricular activity, I think that's been hugely beneficial. And as soon as kids can return to their extracurricular activities safely, I think it's important to do so. And then, within schools themselves, I think, teachers and early childhood educators are heroes, and they're amazing, and they have worked extremely hard during this pandemic to meet the needs of all the students in their classrooms. And so I think, in classrooms where there's good structure and good routine, and where kids know what to expect. Same goes for the home. Those are definitely things that can help and be protective. And even when school wasn't going on, we saw that the kids who maintained their routine, so these would be kids who were still eating well, still going to sleep at a reasonable time, got up every day, got dressed, and did some kind of routine activity, those kids tended to have better mental health. And we also know that not excessive use of screen time is also something that can be beneficial. So really, having some limits around that in the home is helpful for kids' mental health in the context of COVID.
I most definitely agree with what you said. And I think you brought up a really great point about how like mental health is like not just for children, it's for like everyone in the whole family, like the whole social circle back at home. So definitely keeping like a good atmosphere at home is really important for the development of a child.
Oh, for sure, for sure. Yeah, I always talk about clinically with families. I talk about if the nest is healthy, then the birdies inside it will be too.
Mhm. Yeah, that's a great point. And yeah, thank you so much for coming to speak with us on this very important topic of mental health in children.
Thanks for having me, Nicole. It's a pleasure.
Mhm. Yeah, so thank you all for BEaTS listeners for your time. Don't forget to like and subscribe to our YouTube, Twitter, and Instagram channels at BEaTS Research. BEaTS Research Radio is supported by the University of Ottawa Heart Institute, BEaTS Research Laboratory, and the Department of Biochemistry, Immunology, and Microbiology with the Faculty of Medicine. Thank you, everyone, and we hope to see you all next week.